Hello all, this is Mrs. Lalithamani, Associate Professor from SNS College of Nursing. Every month we are learning about a new topic in the lecture series. Here we have an interesting topic comes under the subject Adult Health Nursing 1. So the topic is the surgical instruments, where we will be learning about the history of surgical instrument, how it has been evolved from the ancient period, and what are the uses of the current surgical instruments. Let us go into the topic. So the objective, the study, the session will be like at the completion of the lecture, the students will be able to understand, describe about the surgical instruments with the clinical implications, and develop desirable attitude and apply it in the clinical area. So coming on to the ancient surgical instrument, the surgical instruments designed, it is a specially designed device or an apparatus used to carry out a specified task during a surgical procedure. So historically, like sharpened stones, flints and animal teeth were used to do an incision or to cut open a part, and also to and also to maintain the opening kept for a longer duration of time. Materials were ivory, wood, bronze, iron and silver. So the instruments, what is being depicted in the image are the earlier used instruments that were used to open, keep it cut open, and make the opening available for a longer duration of time. Then the advanced surgical instruments, as listed in the picture, are being produced. Majority of the surgical instruments are nowadays in stainless steel, and the alloy, carbon, iron, chromium, and other metals are also used. They're resistant to wear and corrosion. So the wear and tear mechanism is not possible in these metals, but sometimes the wooden items may go in for a wear and tear, and the animal teeth will get spoiled, but this is not the case. So the restraint from to wear and corrosion, it will be strong. And three types of the materials are used, that is finishing will be like mirror, satin, matte or ebony coatings. So gold plating instruments are also available, which will be like the tungsten carbide, like a hard metal. Coming on to the parts of an instrument, we will be having the basic standard design, which will be holding the, there will be in the image what you see is an artery forceps might be. It has a handle, finger rings, rackets, shanks, joint, jaws or blades and the tips. So the instrument basically holds all these items, and it will be something will be like a holding one, manually holding one, and another thing is that is self-retaining or holding, that is we can tighten it up and it can be left in place for some duration until the surgery is being done. So it is not needed to hold it in the entire time. It can be kept it in a retraining, or it is self-retracting, you can tell it is a clamped forceps. Coming on to the another part, that is a bar, what you see in the image is a Bart Parker hand, that is a dissecting forceps. So the dissecting forceps might be with toothed or non-toothed. Here the parts labeled are handles, rackets, shanks, joints, jaws and blades, including the tips. So the tip will be either it will be a plain, that is seen as an non-toothed forceps, and toothed forceps. And if it is a toothed forceps, we can see the a tooth like a single sharp point like structure, which will be holding, piercing the tissues or the muscles, and it will be holding it in position. So coming on to the next part will be like a retractor. It might be used to widen the space. For example, if it is being used in an abdomen, the intestines will be pushed aside so that the inner vital organs can be visualized. So like that, an instrument which will be blunt, it will not be holding, we will be holding it, that is a manually holding retractors. So here coming on to the handles, we can see the handle, shanks and other parts. So until now we have seen about the few instruments which will be having the parts similar to that, but we have a different name for it. Ancient, it was the even the flints, wooden items, and the animal tooth were used for an instrument, but nowadays it is being modified. We have all the alloy non-restrainable or non-rustable items, which is hard. So we'll see in the next unit. Thank you.